Good afternoon, everybody. Welcome to MagnaWave Office Hours. We come to you as often as we can on Tuesdays and answer your questions about MagnaWave, PEMF, events going on, a lot of good things happening. So I'm here to answer your questions today. Be happy to do that. If you have a question, put it in the thread and I'll be able to have a look at it and answer it. If you'd like to talk with me, simply send me a text to 502-599-9722. I will call you back and have a conversation about whatever it is that you'd like to discuss. Today, we're with you on Facebook, YouTube Live, LinkedIn, and on CastBox with the radio feature on CastBox. So we're glad to be here. If you're on CastBox, you'd like to talk to me, just click the phone and we'll have a conversation, whatever that may be that you want to ask. So this week, Thursday, 10 a.m. Eastern Time, MagnaCon will kick off with a live two-day event. A lot of good speakers will be there. We'll be answering your questions live after you see the speakers. We're giving away over $10,000 worth of equipment and attachments and so forth. And that does not include the machine that we're going to give away to a participant at MagnaCon. So tickets are still available. What is it, Chris? It's MagnaCon. What is this? She told me about it. What is it? MagnaCon, PEMF.com. No, what is it? What is it, Chris? Put it up there. Tell me what it is. Click in and he's busy doing something. He can't hear me. But at any rate, go to the website, register for MagnaCon. Tickets are still available. You'll be entered to win all the great prizes and be entered to win a new machine. And you'll be able to watch replays of all the videos. So if you can't be there when a particular speaker is going to be on, you can watch the replays and catch up on them later. So it's a great opportunity to learn more. I just had a great session this morning with Dr. Marty Goldstein, who will be working with his daughter, his middle daughter, on her graduation Thursday and Friday. But we had a great recording, a lot of good information from Dr. Marty as always. So we're excited about that. So MagnaCon tickets still available. You can get them at magnacon.com, I believe it is, and have a look at that. Or go to the website, and like I say, they're available, and purchase tickets for MagnaCon for your continuing education, or to just learn more about MagnaWave and the procedures that we use with integrative therapies for your health and wellness and well-being. So if you have a question, simply put it in the thread, and I'd be happy to have a look at it. Let's see. Carolina MagnaWave Therapy is with us, and they're asking if Daisy got her tickets for the upcoming MagnaCon, which begins Thursday at 10 a.m. If you have another question, put it up there. I'll be happy to answer it for you. If you don't have a lot of questions today, we won't hang around a long time. We'll let you get back to what's going on and the things that are occurring. My conversation, as I said, with Marty, was very good. I can't tell you everything that we talked about, or you won't have, you're already going to hear it when MagnaCon shows up. But he really made some good comments about the magnetic field of the earth and how the magnetic energy that we're putting into the body, how they works in sync to bring you back to magnetic energy that your body craves and needs for us to live, and help you do that and help you live happier and healthier with a good dose of MagnaWave. So very good conversation. And as I said, it'll be with us on the broadcast as well. Let's see. Good morning. My machine is supposed to be delivered today. Anxiously awaiting UPS. I'm also going to MagnaCon. Great. This is from Lisa Marie. And have you ever heard of using PEMF for fatty liver disease? Well, that's interesting that you talk about that. Certainly, basically, a fatty liver is an issue with the body. The body's out of sync with itself. There's issues going on. You don't know if you know what's causing the fatty liver, then you need to address that. Certainly, whether it's diet or whatever you're doing that could predispose to a fatty liver condition. But if you allow the body to come back to homeostasis, allow the body to get the oxygen that it needs for the cells to get as healthy as they can be, so the body can better fight the problems that are going on. As Dr. Marty points out, you cut your finger, and they can all the science they can do, they can't figure a way of you can put things on it and help it heal and do this, but the finger's going to heal on its own. And if you clean it and you do things, it's going to heal, it's going to close. So if you clean the body, your toxicity level is good, and you're taking good nutrition, and you're helping your cells be the healthiest they can be, and you're putting the magnetic field into the body that it so much craves, as I was saying, then you can help your body help that fatty liver condition. We have seen instances where people have used PEMF on every condition that you can imagine. And we don't heal conditions. We don't heal things. We just help the body be healthier, so the body is in a better state to heal itself. So certainly you can go to Google and seek the information, search the information on fatty liver disease and PEMF, and there's thousands of studies out there, and certainly there may have been one that is done that they've seen good results with that type situation. I go back to the study that we're doing now at in the University of Colorado, Dr. Larry Lyons is doing, and for concussion injuries. And so they're treating people with concussion injuries, whether they're athletic driven or accident prone or whatever the situation may be, and they're treating them to establish brain health, brain recovery after a concussion. But the funny thing that they're finding is, by treating someone's head and shoulders, and for the concussion type of state, they're helping sore backs, they're helping sore hips. And so by helping the blood flow of the whole body to help that, as I was saying, homeostasis, the light comes on, the energy goes in, and the body accepts it and uses it. So it helps to treat the specific area of pain on your hip or wherever it may be. We're learning and seeing that if you treat the head they're using it for concussions, but they're also seeing that these people find recovery and help in other areas of their body. So there's just a lot of opportunity for this energy to be beneficial to a lot of different things that people are struggling with, that their animals are struggling with, and as they go about their business or go about their lives. And we know that the therapy has been shown to temporarily reduce inflammation, to temporarily reduce pain, to improve the blood flow of the body, and then let the body do what it wants to do. It's just a great general wellness type of application. As Dr. Marty also points out, I'm not giving away his talk by any stretch, but people talk to him about, well, what is this? What's it doing? And he says, do you remember Star Trek, or not Star Trek, the when they put him, what was that show? But anyway, Beam Me Up, Scotty, where they put, I guess it was Star Trek, where they put him in the tube and the energy comes down, or the signal comes down, and all of a sudden the person is better. And he says, that's what we're doing. We're putting this signal, this energy into the body, and then it allows the body to better go and better heal itself. So at any rate, catch Dr. Marty during MagnaCon coming up Thursday and Friday of this week. Again, $10,000 worth of giveaways, not including the value of the machine that we're going to give away. So a lot of good things happen. Tickets are still available. If you want to get tickets, Chris, you might put that website on there for where people can get tickets for MagnaCon. And they do get, if you do buy tickets, you do get the replays. So you'll have it. You can look at it at your convenience. Even if you can't make it Thursday and Friday, you can watch the whole thing on replay and enjoy it and learn a lot about MagnaWave. Good morning, Colleen. Good morning, Mary. Tracy's with us. Again, MagnaCon, that's it, MagnaConPEMF.com to secure your tickets for MagnaCon this Thursday and Friday. If you have a question, please put it up. If you'd like to talk to me, it's 502-599-9722. Send me a text. I'll call you back, and we can have a conversation about whatever it is that you might like to discuss. There you go. The link's up to get tickets. And will the live stream be found on the app? It will be. We're using Whova to broadcast the event. And so it won't be on the app as such, but it will be on the Hoof app. And when you purchase your tickets, you'll get the link to get the app and download the app to your phone or your device, so you can participate and follow the stream in that fashion. What times are MagnaCon this Thursday and Friday? Chris may be able to put that up, but it begins at 10 o'clock Eastern time. I know that there are some early sessions, I believe Friday morning in the 7 o'clock time frame for 7 a.m. Again, all of our times that we're posting are Eastern. So, but as I said, if you've got tickets, you can watch it at any time that you'd like at your leisure to participate. But 10 a.m. Thursday for the beginning and rollout of MagnaCon. A lot of great speakers. We're going to be talking about large animals, cattle, those type of things, horses, small animals, people. We have doctors participating. Dr. Amanda Myers will certainly be with us, having a whole conversation dealing with health and wellness from the human perspective. We'll be bringing you up to speed on what's going on with various, with the COVID, how people have dealt with it around the country, utilizing PEMF types of devices and our device to basically help the overall well-being. So we'll be talking a lot of that. Alicia asked a question, is MagnaWave safe to use on pregnant mares in their first trimester and human clients with blood clots? Two very good questions. Alicia, you'll find that most veterinarians or most doctors contraindicate most anything when it comes to pregnancy. Now, we've had situations in the human world where people are having knee and ankle problems during a pregnancy, and they've been cleared to use the device. In pregnancy in animals in the first trimester, or any time the doctor will say, don't do this or don't do that. But we've had situations where mares have had horrible back problems, hip problems. They're going to basically confound her and die and lose everything. In those cases, in specific instances, when you clear with your vet and work with your vet, then you can have clearance, or they can give you an indication of how to do it and how to proceed. But as a rule, as you know, in most instances, about anything is contraindicated when it comes to pregnancy. Now, when we're dealing with human clients with blood clots, again, this is an area that you want to talk with the doctor who's involved. If the person is walking and having no problem, and they're on medication for blood thinning to keep everything going well, not to have clots, but they're still having some back pain or something like that, you're going to treat them for 10 or 15 minutes. Again, discuss this with their doctors and get clearance to do that, but then you'll know what your areas of freedom to treat or work with this client might be. In many cases, as I've said, where the person may have a blood clot that is in a particular area, doesn't move, the doctor's pretty convinced that it's not going to move. And again, if you're treating away from that area, if they've got a blood clot in their leg and you're treating their ankle, there's different ways to approach that. And again, make sure that you get everything cleared and okay by your physician when you're providing these types of energy-related supplementation to the body. And then you'll understand, and they'll give you clearance on what they think is safe for your client. So great questions. I appreciate that. If you have other questions, simply post them up and I'll be happy to have a look. If you'd like to talk to me, 502-599-9722, and I will get right back to you. If you call and we have a discussion, you'll be entered to win a grab bag for today, and containing MagnaWave swag with the new logo, shirts, hats, drink cups and bottles, and various items that we have available to you for your use to enjoy. Okay, let's see if we have another question here. Alicia says, thank you. You're welcome, Alicia. Hope that was helpful. If you have a question, give me a call. We'd be happy to talk with you, or if you have a question, post it in the chat box, and we'd be happy to answer any question that you may have. A lot of things going on today, a lot of questions being asked about what's happening with various illnesses and indications, and certainly with the COVID going on, people have a lot of questions about that. Is it possible that MagnaWave can help epilepsy in dogs, in particular help with prevention? Thanks. Again, Dr. Pollock has talked about using PEMF and the successes that have been had with people and with animals that have epileptic type of situations, epileptic seizures. Again, if you're dealing in a veterinary world and you're using it as a precaution, if the incidence can be there for something being there, just to simply provide the energy to the body, allow the body to best be prepared to deal with itself, then you can have some good situations there. But if it's a ongoing state of seizures and you want to know what the safety is to do that, certainly work with your veterinarian. You can Google PEMF and epilepsy, and there's thousands of reports that have been made and a lot of papers written that could help address that. Are there capabilities of having good results with epilepsy seizures? Yes, it's very well documented in many places where success has been achieved using PEMF and MagnaWave to treat and to deal with those types of issues that people may be experiencing simply by helping the body be prepared to take care of itself. Okay, PSSM horses started one following the protocol at the top, but made him more sensitive than before. Normal did help him. Well, you know, every animal is different. Every person is different. And so they're going to react to the energy that we're supplying. And even though they became more sensitive, but then it did help. Well, so you got to measure, you got to take what you get. And certainly with more time and the more subsequent number of treatments, you might get down the road to where you're really getting the result that you're looking for. As you know, we always talk about we treat as long as the function continues to improve, and then we treat as often as necessary to maintain the function that we've achieved. In many cases, things are caused by anatomical problems, and so all you can do is relieve it and wait for it to return. If it's a pinch, if it's a chip, if it's something going on that will cause it to reoccur. If you have a bone spur in your foot, and you can take away the inflammation and relieve the pain, but as soon as you start working, it's going to work to come back. Now, if it's soft tissue, muscular, and there's some inflammation and there's pain there, we do know that we've seen relief of inflammation by utilizing MagnaWave and PEMF, that you can get ahead of that and do it. A lot of times the pain doesn't reoccur. The problem does not reoccur once you get ahead of it. So that's, again, where we have to learn. And that's what's so valuable about the MagnaWave research and education, international research and education, where you can go in there and search particular questions and what people have done. You can go to the MagnaWave website and go to the testimonials and have a look at testimonials that have been made by people who have done many, many, many different things that they're working on, many different issues that they're dealing with, and they'll talk about that and certainly be willing to address that. Next, explode on the let's see. Not explode on the lunge line, as owner reported previously. And, you know, lunge lines, that's an interesting situation. So there you're seeing some improvement after continued treatments, and then you can make those kind of comparisons as to what's going on. Good morning, Christine. Good afternoon. Sarah is with us. Thank you. Hi from Maryland. Megan's with us. Great. If you have a question, as I said, send me a text, 502-599-9722, and I'd be happy to give you a call back and have a conversation, whatever that may be that you would like to discuss, and we'd be happy to do that. If you have another question, simply post it in the stream and we'll get it, whether you're watching on Facebook, YouTube, wherever it may be. We'll be happy to answer your questions and help you get the answers you're looking for, certainly. Okay, let's see. A lot of folks with us. We appreciate that you're here, and we hope that you'll be with us on MagnaCon as well, coming up this Thursday and Friday. Great times are had. Great way to learn more, get your questions asked. And what we're going to do is we're going to have a lot of speakers, as I was beginning to say a few minutes ago, covering all types of situations, from people to small animals to large animals to horses to cattle to show pigs, whatever it may be. We're going to be approaching those areas and giving you questions. So we have a lot of recorded videos that people have made in advance, and then they'll join us live after the video plays to take questions from the viewing audience, which will also be recorded. So in the replays, you'll be able to hear the questions and the answers, or you can catch them live as they're being asked after the speakers participate. In the case of Dr. Marty, we'll be around answering questions, but he will not be, because he's going to be off with his daughter celebrating her graduation from school. And I told him that we're all going to be celebrating her graduation as well. well. So that's kind of cool to have that type of situation going on. Okay, Colleen asks a question. Do we have any osteopaths in our organization? We have one that comes through our town and works on people and horses and has told all of his clients that PEMF kills the nerve ends and he will not work on anyone who gets it done. I haven't lost any of my regular clients, but has definitely reduced a group of potential clients. I don't understand his reasoning and don't really know how to deal with it. So far, just going along and ignoring it. Well, unfortunately, people will make statements. They do have their personal beliefs, which they can certainly have. Many times they confuse various different modalities. And we've had some confusion with this over the years where we're talking about MagnaWave being a pulse electromagnetic field that provides energy to the body. And then there is shock wave, which provides a compression, whether it's through sound waves or actual compression to the body that is used on a particular area to bring blood flow to the area. They're doing it to bring blood flow to the area to help the area heal, but they're doing it in a form of compression or sound waves that can and has been said, I don't know but shown that it could hurt the nerves in the area, and he won't work on anybody, or not he won't work on anybody that has that. But sometimes the docs have some confusion. But when you talk about, I know we've had osteopaths that I've dealt with and talked with, and certainly other human docs and regular commercial medicine or straight medicine doctors who understand and they do a little research. The question would be, ask those people to research that. It typically with MagnaWave is not the case. It has not been shown to deaden or damage nerves. And all we're doing is supplying the energy that the earth provides to us that we need to live. We're just boosting that, putting it in the body so the body can be better aligned to help relieve inflammation, to relieve some pain, and allow the body to be better able to heal itself. If you have a name and it's somebody that potentially I can speak with or our medical advisor can speak with, Dr. Amanda, we will certainly try to clear up those types of things. But understand that we're in a situation that if any modality, not us necessarily, but any modality, if it does cause problems and people do suffer from different things, the FDA has the right and the ability to stop people from doing things and stop them from manufacturing and that type of situation. And so for the last 30 years or so that PEMF has been really commercially available in the United States, there's not been any problems with the FDA to where they've reached out and made anyone stop, or where there's been any types of situations. There's no real understanding or no documentation of injuries or anything like that. So it's just a situation that you need to deal with. There's plenty of information. Send them to the website if they have a question. If your clients have a question, call me, call the office. We'll show and provide as much information as we can to help clear up those types of questions that someone may have. And I went through all of that. I mean, there was the time, and I've told the story that when I started on the racetracks, this is where I went in the beginning, was the racetracks and the 100 jumper horse shows and that type of thing. And I got my horse clients by treating the riders. The riders wouldn't have sore backs and sore knees, and I'd help them feel a little better, and then they would understand and let me make their horses feel better. And we're going back now, 2005, 2007, 25 years ago, this is not 2020, started in 20 years ago, anyway, started in 2002. So we're sneaking up on 19 years of doing this, and certainly it was around before that. So there's a lot of time and a lot of ways that we can learn. But as I was saying, when I first started, I was the crazy guy pulling this box around, thinking I can make horses and people feel better, have better energy. Then I became Dr. Voodoo. I don't know what he's doing, and it maybe worked, but and then it became, well, it's working, but it's got to be illegal. It can't use this on the horses. It's got to be some magic stuff that is not going to be allowed. And then all of a sudden it became, oh, I'm a veterinarian, or I'm a trainer, or I'm this. I want to use this now to help my horses feel better. and so forth. And that's just been the progression. So when someone asks a question like that, or they make statements like that, my situation is best question to ask is, well, do you have documentation that that's the case? Then you can find out what modality they're actually talking about. Then you can find out if they have some substantiation to what they're talking about. And I've always found over the years that typically has not been there. And once people understand that, once the doctor or the person actually sits down and talks about it, they can quite often have their questions answered. So there you have it. If you have a question, call the office, try to get us in contact with this person, or if someone has those types of situations. Okay, Unknown said hello. Thank you. Let's see. Hi, everyone. Diane, looking forward to MagnaCon. Can MagnaWave help with the vaccine lump? A dog worked on yesterday has a lump in her shoulder from a vaccine. Well, certainly you're going to massage the area. You want to open up help the viscosity of the area to kind of push things away. It's an inflammation. If there's a lump there, there's an inflammation. There's a buildup of fluid, whatever it may be. There can be many different things. And to work the area and the area around the area can be shown. We've seen cases or situations where it looks like that has been helped and can help those types of situations from where an injection was given into a muscle and you just want to smooth it and have it go away. So potentially it'd be very beneficial to that. Let's see. What is the number to call in again? 502-599-9722. It's on the screen there. Give me a call, 502-599-9722, and I will connect right back with you and we can have a conversation. It's Carly that asked this. Okay, Carly, great. Thank you. Appreciate it. Let's see, anything else? If you have another question, simply put it up and I'd be happy to have a look and answer any questions or do my best to answer any questions that you may have. And certainly as we go through MagnaWave, it's really, it's amazing. I've been working with Dr. Marty now since 2007, I guess it was. And so there's a number I can call back here in just a second and then we'll have a conversation. But I've been working with him for that length of time. We speak all the time about various things. He's been very quick. He came on, we did a webinar a few months ago or during the COVID thing. The question was, what about animals and COVID? Can they pass it? Can they have it? Is it the same thing? And there was a picture online at one time where there was a coronavirus vaccine that they give to horses. And the coronavirus has been in horses for a while, but it's different. It's how it attacks, how it works. And so it's not passed, it's not contagious in that fashion. And people had a lot of questions about that. So he came to us and explained that. But today, when he talks about what he's doing now with his line of supplements and what he's learned and how he's applied this to the areas, the large American veterinary hospitals that are using MagnaWave PEMF in their hospitals and seeing great results in that thing and what he's done. Every time I talk with him, I get something new. I get new information as to how he puts it, how he frames it, how he writes it. It's interesting. He's got his new book coming out. His book that he did in 1999, he was telling us, was been in the top 10,000 books on Amazon, and there's millions of books on Amazon for the last, since 2009, 20 years. And he's got a new book coming out. He was very kind. I contributed to that book, not as an author, but just as a contributing some information. Dr. Amanda Myers has a piece in his book where she's talking about PEMF, the energy to the body. So it's really good. The book does not come out till February 2nd, he was telling us today is the release date, but you can go to Amazon now and order it and you'll get it when it comes out. And that happened a couple of weeks ago, and already he shot the #1 in his category for the book and the information that he provides. So anyway, it was a great conversation. I always learn something from him. Let's see who I've got here and give them a call. Laurie's got a question. Let's pull it up, give Laurie a call and have a conversation with Laurie. It's ringing.
Good afternoon.
Good afternoon. How are you? Are you there?
Hello?
Hello. Can you hear me? Lori? Oh, wait a minute. I'm sorry. I had the mute button on. Good morning.
Oh, hi, Pat. Hi, this is Lori Reese.
Uh-huh.
I have a question about, I have a warm blood that I am going to be helping out with that has had numerous abscesses in his hoof and his back heel. I believe it's a front foot.
Right.
And I haven't worked on this horse yet. I haven't seen him, but I know that he's coming my way in the next 10 days. And what they did is they actually had surgery on April 27th, and they cut up the side of an old quarter crack. They thought that maybe this abscess that keeps happening, the vet doctor from Kentucky actually went in to cut that out, did find some foreign particles that was heading towards the bone instead of abscessing out through the heel. Anyway, so they cut up through there, and then they applied the maggots to eat out the decrepit tissue.
Uh-huh.
And my biggest question is they will be done with, they put the maggots in there for about 7 days. Once the maggots are out, which is this Sunday, normally we have learned and agreed that we don't start MagnaWave probably within 7 to 10 days after something like this has happened. You want the insides to start healing before the outsides.
Okay.
I guess I'm just calling to confirm with you the best protocol to start with this fellow. He will have metal plates on the hoof to keep the hoof intact, since the surgery is up through the side of the hoof.
Right. And that's fine. The metal plate should not cause a problem. No heating or anything like that. I would start in this case. They're cutting away, so they want it to heal. I would start if there's no bleeding at that point or anything going on. I'd start as soon as we could. As soon as a doc. Now, if it's a break and it's a bone, and I want to preface that the reason we delay treating a bone break is because we want to make sure that if they do a radio exam, that they can see what the healing process is. In some cases, if you start right away, they get a false indication because it kind of closes in around the break, but yet it's still brittle or not yet formed in the middle. And so we want to wait a few days so it can start growing or healing from the inside out. That's why we wait to 10 days, 7 to 10 days.
Oh, okay. So that's more of a bone break, but not like for tissue.
That's correct. So in this case, if there's no bleeding and you want good energy to the area and you want to try to keep the inflammation at bay and the comfort of the animal, then I would start certainly as soon as you can.
Okay. Well, I have to convey that to them. And as you've mentioned many times, a lot of vets and farriers and all these great professionals that we need and use are not quite up to date on the benefits of this machine and process.
And exactly, and that's what Dr. Martin and I were talking about it today. It's changing every day. When integrative medicine was adapted into veterinary and homeopathy and naturopaths and that type of thing, it just takes time, but sooner or later everybody learns that this is the value of these various modalities that are out there, and they begin to integrate them into their practices. Unfortunately, no matter what it is, some people are very happy in their lane. They don't want to get outside of their lane, and that's where they are. And so sometimes it's tough to convince or have somebody try something new. But as time goes on, they will do that. I can tell you today, it's totally different than it was in 2002 when I began working with PEMF and the knowledge and the understanding of the therapy. Certainly. So
I was going to use, of course, I always like mixing it up. I use the small coil, sometimes use the large coil and loop it around. It seems to get different effects in different ways. I also, of course, have the paddle.
But I would do that to approach the tissue from different directions, different intensities, keeps the tissue fresh to what it's receiving. Just like most things, if you put it on at the same attachment, the same place, the same power each time, over a period of days, the body kind of gets used to it and sloughs it off. And so that's why you want to approach it from different directions. The tissue likes that, and it heals better in that type of situation.
Okay. All right. That's awesome. One more question, if you have time.
Sure.
I'm also working on this laminitic pony Hackney mix that has Cushings, has diabetic issues. I mean, the poor thing is, you know, one of those typical older ponies that's got all the problems. That's becoming laminitic, and I've been using the paddle. She has no interest in standing on that box. Okay. So I have been holding the foot, and she's actually been pretty good about it. She'll hold the foot up like I'm picking at it, and I'll put the paddle right on it.
That's
of course,
perfect. That's perfect.
Yeah, I know, but it's zapping the heck out of me.
Okay.
So
what you might want to do is
I'm putting it as strong as I can handle it.
Well, okay, then do this. You don't have to use the paddle. The paddle is more intense. Use the butterfly. Put the butterfly on there, and you're going to get the same. You won't get as much energy as you will with the paddle, but you know, try the butterfly. And then the fact that it's zapping you to the point that you want to be comfortable with it, that's okay. Make sure if you're comfortable, you're still supplying the energy that's necessary to help that horse feel better. Now, to that end, if it's on the right foot, make sure you also treat the left.
Oh yeah, no, actually it's there. I mean, yes, we're doing that anyways, but we have, of course, concern that usually if one starts getting laminitic, the other one's coming. Yeah,
and so you want to stay on that and make sure you're treating both sides. The other thing that you could do is, if you don't want to stand on the box, and you know every animal's different, use the butterfly and wrap it around the hoof, or use the paddle and lay it on the side of the hoof. Do a minute or two on the left side, do a minute or two on the right side, set it on the front of the hoof. You're getting it. You're going through there, no problem.
Sure.
And then,
yeah, I guess I was really focusing on putting it on the foot, like flat on the foot, going straight up in there.
That's perfect. Do that, but do it at a setting that you're comfortable with.
Well, I have to tell you, my wrists were hurting from braiding, and they didn't hurt after that.
Well, there you go. There
right?
You have it. Okay, great.
Okay. All right, I think that's all I have for today. I've been kind of waiting for you to have your office hours today. So thank you very much.
Send an email to support at MagnaWave PEMF.
All right, take care.
Bye-bye.
Bye-bye.
Couple of great questions. I always enjoy that. And if anyone else has a question you might want to discuss, you see, we go a little deeper. When I just answer the question that you type in, I'll answer it as the best I can think of it at that time. But when we're conversing, we have an opportunity to go a little deeper and cover more stuff. Maria asked the question, how soon do you estimate Health Canada will be approved MagnaWave machines? Okay, we have applied to Health Canada for the digital machines that we have at this point, and Health Canada, that's a process that we're going through. We have everything in place as far as safety testing, as far as the ISO stipulations in place, and then when all that's in place, you can then go to Health Canada and request Health Canada approval, and we've done that. It's just a matter of waiting for that to go through their bureaucratic processes, and as we've learned, a lot of that has greatly slowed as a result of the COVID pandemic that we're experiencing today. I received a note from John Stevens this morning. I'm going to send him back. He hasn't been with us on the office hours for a while, but he asked, what is the progression of the CE medical device mark for Europe? And everything is completed on that, and we've been waiting for them. It's a long story, but they were to come back and inspect our factory for the last time 3 weeks ago, I was told. And because of COVID, it's been unscheduled, and now we're back in a waiting pattern. But it was scheduled. They were going to come at the end of May, 1st of June, to inspect the factory. The factory was inspected and passed a year ago, but the company that did the inspection inspected a whole bunch of businesses, a bunch of factories. They did not submit their paperwork properly, so the whole thing had to start over again. And the people that have existing products that have been approved were first expected. The folks that have new products coming in, which our digital devices are, then we had to just basically be in line and wait for this. And as I said, it was scheduled for a couple of weeks ago, and it's been put off because of the COVID. So I spoke with them this morning, in California, and they're hoping to hear back any day to get that done. But that's different than Health Canada. Health Canada operates on a very similar system as the CE in Europe, but it's a little different, and everything was fine there, and we fulfilled all of that and submitted all the applications for the approval in Canada, and we look forward to having that soon. European CE is a little different. They have to physically come back and check the factory one more time to make sure that when they did it properly the first time. So that's an update on that. I hope that's clear. Certainly appreciate the questions, and all that is good. Let's see if we've had any other, anyone else text us. Nope. All right. If you have a question, put it up. If you'd like to have something discussed, let me know, and we'll certainly discuss it. As I said earlier, if you're joining us, MagnaCon starts Thursday, 10 o'clock Thursday morning. We'll be coming to you live, and then we'll have speakers joining us, and we'll have live questions and answers throughout the period. If you buy a ticket to MagnaCon, you'll have access to all the replays and everything that you can enjoy and learn from MagnaWave. Maria, no problem. You're very welcome to have that question answered. You're great. Thank you so much. So there it is, MagnaCon PEMF. If you'd like to buy tickets for MagnaCon, there's still certainly there's a lot of tickets available, unlimited tickets. That's the nice thing about the virtual aspect of MagnaCon, is we're not limited by the facility that we're in or how many buses we have to have and all that kind of stuff. But well, listen, we're missing going to Churchill Downs and all the fun that we have when we have MagnaCon. We work real hard at education and information, and real hard at having a good time and a lot of fun. It's pretty much what we're about in many different situations. Let's see here. What do you recommend on a horse with EPM? Okay, that's covered extensively in our training, but typically what you run into with EPM is, and I'll give you both scenarios, as we started treating horses with EPM years ago and what some doctors are talking about today. And when you talk about the medications that are given, and you have parasites that attack the nerves, and it's like a painful, very painful situation. It's debilitating. It makes it so they don't want to perform. They don't want to be comfortable at anything they do. And so we've always, in the past, at the beginning, we recommended let them do the regimen of medication that they're doing, and then begin treating the animal after that. And you typically will not attain the result that you're looking for with one treatment. A lot of times, if you have a pulled muscle or a sore situation, 1 or 2 treatments, bingo, you're in good shape, and away you go. The animal or the person is happy, the small animal's happy, and you go forward. In its EPM situation, it could take multiple treatments to get them to where they feel better and continue to perform in a manner with which you want. Some animals, we've had situations on the racetrack where horses have had EPM and they get treated continually for years, once or twice a week, or whatever it requires to keep the horse happy and in a good performing type the situation. Now today, and many doctors are deciding that if we're going to give a round of medication, let's treat during the medication process, because you'll get an enhanced application of the medication. You'll get a better metabolization of the medication as it's being applied. And so, you know, when they give medications, quite often they'll say, well, it's this strong, and you're only getting 20% of that absorbed into your body, or 30%, whatever it might be, from a particular medication, because a lot of it passes. Whereas if you're treating at that time, you can get a better absorption or a higher absorption into the body, which is what they might be looking for with this particular type of medication. So some doctors have kind of changed. They kind of approach it now from the standpoint, let's treat, and let's treat while we are providing the medication for the issue that they're dealing with. And so if you have an EPM animal or EPM horse, you want to talk with your veterinarian, and always consult with your doctor and get their advice on what they would like you to do or how to implement it. Again, in the past, it was provide the medication, then treat as often as necessary to maintain a good balance and a good position for the health and wellness of the animal. Today, it's changed a little bit in some circles to where they treat during the medicating process. That is true in many other types of things that doctors deal with. There are doctors now that are applying in the United States. In Europe, they have done it for some time. When someone's receiving chemotherapy, there are some docs now that provide our type of treatment during the chemotherapy process. Again, in most cases, we've waited for the chemotherapy to be completed and then begin the treatment for comfort and pain relief and so on. And but because we don't want someone to get sicker, but by an increased, improved metabolization of the medication. But there's 2 or 3 different schools of thought and how to do that and what to look at. So always certainly consult and talk with your doctor. Let's see. Laminitis with the pony, also Cushing's. Any special place? I have MagnaWave for that pituitary gland. Treat around the area. It's kind of like I was pointing out with the concussions. They're learning that treating the head and shoulders is helping people with back pain. So you don't have to be directly on it, but I would treat the area, the pituitary area, and treat around that, and treat overall. Good body treatment is going to provide energy to the body, going to provide immune support to the body to help those types of situations. Great questions. All right, let's see here. Any other questions? Put them up. It's 1:15, and we're going to be here for a few more minutes unless the questions are gone. Again, don't forget MagnaCon will be there. We're going to look forward to talking with you at MagnaCon and learning a lot. We learn amazing amount of information from you, the participants. A couple of things that I wanted to try to cover here. I forgot one, but I will remember the other one. Hope I don't get emotional during this, but this week we lost a champion to veterinary medicine, particularly to the saddlebred world. Dr. Scott Bennett passed away. He's had a tough fight for the last few years with cancer and a lot of different things going on. And Scott Bennett, to me, holds a special place. He was one of the first doctors to talk with me, to purchase and accept and use our equipment in his practice, which he has done, which they at his practice do to this day. They've had a few machines and at his clinic, and with great success. And so I will miss him. I miss our conversations. He had a different type of sense of humor, but he was kind of guy that he was just a wonderful person. But he would tell you what he felt. He would support you if you felt you were due support. I'll never forget. He called me. He had a world champion saddlebred, won the world championship on Saturday, was lame on Sunday and Monday. And when I got there, he called me up. He said, "Bring your magic box up here and treat this horse." And went up there, and the horse was laying in the stall. And we simply placed the coils in place and put the feet on the coils. And within a couple of days, the horse was up and standing and recovered nicely and went on. Never got to go back to competition, but was able to be used in birth and stud and so forth. And so it's just, it was just a lot of fun. He would question what we were doing, but he would look at what we were doing. So Dr. Scott Bennett was a wonderful man, a wonderful doctor, and I'll miss him. And I know a lot of people will in the saddlebred world as well. So that's something this week that has happened, and we're all saddened by that. So dedicate today's program to Dr. Scott Bennett. Any other questions? Simply put them up, and I'd be happy to address them. It really was cool when he called me and said, "Come out and see me," and ask a bunch of questions. He asked me a bunch of questions that I didn't know the answers to at that time. And he was patient to allow me to go to the people that I had to go to get the answers, which I tell you to do all the time. If someone asks you a question, you don't have the answer, call us. We'll give you the answer. We'll even call them and talk to them with the answer to help them get the information that they're looking for to help you be successful with the health and wellness of your person, your animals, and your clients. So good thing. All right, let's see. Any other questions? Be happy to answer them. Gosh, there was something else I wanted to bring up, and I can't remember that either. But it'll come to me maybe before we go off. But I did want to mention Doc and how we feel. All right. Anything else you have? Simply send me a text, 502-599-9722, or click on the phone icon on CastBox, or put it in the, thank you, Carrie. Put it in the chat box on YouTube, LinkedIn, or Facebook, and we will certainly address it. Yeah, Carrie, thank you so much. It's a tough type of thing. That's it. So anybody else have a question, please put it up there, or we will say goodbye for the day and see you on Thursday morning at 10 o'clock. So we will go. It has been enjoyable today. Thank you for the great questions, and we do look forward to you joining us at MagnaCon. Tickets are available, and we'll be back hopefully next Tuesday. Let's see, travel. We're going to be traveling next week, so I'm not sure what the situation will be next Tuesday. Maybe we'll have a replay, but at any rate, thank you for joining me today. Look forward to visiting with you. Wave on to health and wellness, and enjoy things. Have a great day. Bye-bye.